Hello, thank you so much for tuning in today. I am very excited to talk about this topic because spasticity is one of those symptoms that is just, I think, the most frustrating and discouraging. And there's lots of things that we can do to manage spasticity, which is amazing. And if you're wondering what those things are, we have had recent podcast episodes about spasticity management. You can refer to podcast episode number 81, which is an episode where I talk about what spasticity is and different things you can do to manage it from a physical therapy standpoint. Then we have Missing Link podcast episode number 118, which is where I talk to Dr. Mitzi Joy Williams, who is an MS neurologist, and she shares her approach to treating spasticity. And then we have episode number 157, where we talk to Dr. Barry Singer. He is an MS specialist and neurologist as well, who talks about his way of treating spasticity. But what we're going to talk about today isn't necessarily spasticity treatment, but things that can happen when you're treated for spasticity. So, when you have spasticity, that means that you are experiencing muscle tightness that more times than not is so tight that it is preventing you from moving in the way that you want to move. So, for example, if you have really tight quad muscles, really spastic quad muscles, those are the muscles on the front of your thigh. And when those muscles are tight, they straighten your knee. Therefore, bending your knee is going to be really challenging because your knee is going to be straighter. And let's say you're experiencing this quadriceps spasticity, and so your doctor gives you a referral to get baclofen or maybe botox or massage. There's lots of different things you can do to treat it. Let's say you do one of those. Let's say, for the sake of this specific situation, let's say baclofen. Baclofen is an oral medication. Therefore, it is a systemic treatment approach, meaning when you take it, it will likely relax all the muscles in your body, not just the muscles in the specific area where you're experiencing spasticity and muscle tightness. Now, if you instead went with the Botox approach, that is an injection that is injected directly into the muscles that are tight. So that is not systemic. The only muscles that you will notice are looser are the muscles that are causing the tightness. Either way, whether you go the baclofen route or Botox or something else, it's really important to understand what might happen as a result of relaxing your muscles. So often I've had patients who started taking baclofen or they got Botox and they were so excited thinking, oh my gosh, this is going to solve all my problems because the main reason I can't walk is because I'm restricted. I can't bend my knee or I can't lift my ankle and it's due to this muscle tightness. So holy cow, when I don't have this muscle tightness, the sky's the limit. And while so for some people that is true, I don't want to burst any bubbles, but what might happen is that your muscles, because they were so tight, you weren't able to use them in the appropriate way. You're not able to use those muscles, they get weaker. Right? That's a normal thing with MS or without MS. So if you haven't been using your muscles in the right way and they're weaker, and then you get something to release the tightness, now you're weak and those muscles are loose. And so what can happen, especially if you are having this tightness or spasticity in your legs, is you might feel like you have jelly legs. And jelly legs is actually a term that people will use when they're talking about how they feel after they're treated for spasticity. Or some people might say it feels like their legs, one or both, feel like noodles. And the reason this happens as we just discussed, is because there's underlying weakness. And so it's going to be really important if you managed your spasticity in some way and you too are feeling like your balance is all over the place, or you can't lift your legs up as much, or you're more likely to trip and fall and you have these jelly legs or noodle legs and they just feel loose underneath you and you can't depend on them to help you stay upright or even stand up with good strength. It's going to be really important that you modify your movements temporarily. Oftentimes, the tightness that we have from spasticity is actually helping our strength out. It's almost masked as strength. So, for example, let's stick with the example of the tightness and spasticity in the quadriceps, the muscles on the front of your thigh. When there is spasticity there, it will straighten your leg. So, it will straighten your knee. And so, if a physical therapist comes up to you and they tries to bend your knee, they won't be able to. And it looks like you're really strong, like, whoa, I can't bend your knee at all because you're keeping it straight. Great job, you're nice and strong. But in reality, that wasn't strength that was keeping it there and preventing the bending. It was the muscle tightness. So when that muscle tightness goes away and there wasn't strength there to begin with, you're not really going to be able to use that leg as effectively as you might have thought you would be able to, because the reason that you were able to stand up straight, or the reason that you were able to walk, even though it might have been a funny walk and challenging, was because of that spasticity. So when you get rid of the spasticity, it's going to affect you in a different way. I don't want to say in a negative way because you'll be able to move that body part easier, but it might make your overall balance and stamina and strength much different. So the good news is that there are things that you can do about this. First and foremost, if you are taking a medication, talk to your neurologist about potentially reducing the dose because it might just be too high for you and your body. But regardless, let's say you did something to help manage your spasticity and it worked. Yay, the spasticity is less, but you're noticing this weakness and jelly legs or noodle legs. What can you do? This is a perfect opportunity to strengthen your muscles with functional exercise. The goal here is that while your spasticity is away, you get as strong as possible. And more likely than not, the spasticity will start to come back. And that's when you'll have to take another dose of your medication or you'll have to go back for another botox injection. But if you don't strengthen your muscles, then you're just going to constantly be bouncing back and forth between tightness and weakness, tightness and weakness. So we want to get your muscles as strong as possible when the tightness isn't kicking in, so that when the tightness goes away, you will still have muscle strength beneath that. So the way to do that is to do seated exercises. I love seated exercises because they're so safe. Anyone can do seated exercises without falling down or tripping or having your knees buckle from underneath you or hyperextend and pull backwards. So when you're doing seated exercises, it's just a more controlled environment. So hopefully you know this by now, but I have lots of seated exercises demonstrated on my YouTube channel and my social media channels. And if you're inside my online MS wellness program, the missing link, there's more than you could ever imagine in there. But examples might be seated marching to strengthen your hip flexors, seated leg kicks to strengthen your quadricep muscle and your hamstring muscle, seated ankle dorsiflexion to strengthen the muscles on the front of your ankle to reduce drop foot, maybe heel raises where you're strengthening your calf muscles. There's seated clamshell to strengthen the glutes. There's lots of exercises, but you do them seated. Because remember, at this point, your legs are probably feeling a little unstable underneath you. So if you try to do your exercises standing, it might actually result in your knees buckling and you end up on the ground, or your knees giving away and you end up tripping, or you can do the exercises, but you just don't have the appropriate stamina and endurance. So you can't do that many repetitions. So sit down, do your exercises seated, have good quality, do as many as you can with good form, then take a break and do maybe 3 or 4 sets of those exercises. And then once you're feeling stronger, you could do the same exercises, but in a standing position. And then you could progress to doing them when walking. And I'm saying this all pretty quickly right now, but just so you know, that might take weeks, if not months, to go through that progression of seated to standing to implementing it into your walking. But that's the general flow that you would want to go. And the best time to do that would be to do them when your spasticity is gone. So you've managed your spasticity, it's either gone or greatly reduced. That's when you need to focus on your strengthening exercises. But keep in mind that they will feel different than how they felt prior to managing your spasticity. We just recently had a member inside the MSing link comment in our accountability group saying, "Oh my gosh, I just got my first botox injection and I can't do the exercises anymore. They feel so different and I don't feel stable. What do I do?" And because I've talked about this topic with my MSing link members, tons of MSing link members commented saying, "Do the exercises seated." And they were giving this great feedback, and they were absolutely accurate. This person was doing these missing link exercises for about a year before getting this Botox injection. Then she gets the injection and the exercises feel completely different. That is a normal response. Unfortunate because you used to feel nice and strong when doing them, but completely normal. And if I'm being honest, I think it's a good thing to realize, whoa, I might not have actually been getting stronger. It was just my tightness that was kicking in. And that can be a really powerful thing to happen because now we can get to the root of the problem and actually strengthen your muscles, not just strengthen the tightness that was kicking in, but strengthen the weak muscles. And that's what's actually going to help improve your mobility and make your daily activities easier. So, yes, they are likely going to feel different. Your exercises will likely feel different than what they felt like before you managed your spasticity. But I would encourage you to view it as a good thing, even if it means that you used to do the exercises standing and now you're doing them seated. It's okay. We want to strengthen these muscles in a slow progression. We want to start with the easiest position first and then slowly work your way to the harder positions as you're able to. For most people, this feeling of weakness out of nowhere because you manage your spasticity and now you're feeling much weaker, this feeling is temporary. And it's either temporary because you realize the dose was too high, and so you're going to reduce the dose, and that affects you less. And so it allows you to still feel like your spasticity is less, but you didn't lose a ton of strength. Or it's just temporary because your body will get used to it. And once it's used to it, your body will be able to move in the way that you want it to and in a more effective way without feeling these jelly legs or noodle legs. So usually it is temporary, but we really want to use that time where you are feeling weaker to our advantage because it just really shows you what is actually happening with your muscles. So when the tightness isn't around, how much strength do you have? And someone listening right now might be feeling like, I can't resonate with that at all. When my muscles get looser from Botox or baclofen, I feel great. Amazing. That means that you do actually have strength beyond the tightness. When the tightness is gone, there is strength there. But for other people, when the tightness goes away, there is very little strength. And that's when you'll feel that instability and weakness and poor balance. So use that time to exercise and just know that it is normal. It's not ideal, but it is normal to experience that. Things will feel different, but more often than not, it is temporary. And again, just talk to your neurologist and your healthcare team about how you responded. One final story I want to share with you is I had a patient that I used to work with who has multiple sclerosis, and she came in one day and said, "Dr. Gretchen, my legs are so tight today. I just cannot straighten my knee. I don't know what's happening, but it hurts and it's tight. Just what can you do for me?" And this specific situation, it was her hamstring muscles, the muscles on the back of her thigh that were really tight. And knowing this, I said, great, I have lots of things that I can do to help you out. And so we did a lot of massage and stretching to her hamstring muscles. And we spent a full 30-minute session doing that. She walked out of the session feeling amazing. She walked into the session having to use her cane, and she left the session not having to use her cane. She felt awesome. She felt much looser. And then I saw her 3 days later, and she said, Dr. Gretchen, I felt so great when I left the clinic and for the rest of that day. But when I woke up the next morning and all until today, I have felt so unstable. I've had to use my cane everywhere that I go. I just feel like my leg's going to give way. And as soon as she said that, I realized, oh my gosh, we worked so much on releasing this tightness, but we didn't work on strengthening the muscles as well. And so we got rid of the tightness, but she didn't have enough strength to allow her leg to be strong and to stay underneath her and to make her feel balanced. So, another approach that you could take and that we then took is to release the muscles, but not all the way. And you might be able to do this with baclofen as well. Maybe you're taking a medication, but just a smaller dose so that you actually do keep some of the tightness. Because when all of the tightness goes away, your legs are too unstable. But if just some of it goes away, they're still stable. Yes, there's a little bit of tightness, but you're still able to move better than if you had all of your tightness. And just know, I'm just using baclofen as one example of a medication. What I'm talking about today can happen with any medication for reducing muscle tightness and spasticity. And I was referring to Botox injections. But again, these principles that we're talking about apply to anything that you do to manage spasticity, whether it's a medication or injections or anything at all. So once she came back in, we did do some stretching and massage to release some tightness, but we also focused on quad strengthening and hamstring strengthening to allow her to feel more balanced. And she agreed that after that session, she felt much more stable, still looser in her muscles, which was great, but not so loose that she felt wobbly. So I hope that if you are someone who does have spasticity and that you have tried or are currently trying different techniques and strategies to reduce your spasticity, and maybe it wasn't going well because you felt more unstable, hopefully this helps you feel less alone and also gives you some strategies and tools on how you can move forward without feeling unstable, or just using this as a time to really focus on getting stronger so that when your re-up comes of a medication or injection or whatever it is, you might not need as much and your muscles are stronger. And if you are new to the Missing Link podcast and you don't really know what I'm talking about when I was referring to some of those exercises, I will leave a link in the show notes where you can learn all about the Missing Link, which is my online MS wellness program. You can see a behind the scenes video of what the program looks like on the inside. And on the link that I will post, you'll see everything that is included so that you can decide if it's a good fit for you or not. If you are looking for MS specific exercises that can help with spasticity as well as strength and balance and walking, the Missing Link is something that shares exercises you can do with full demonstrations and cueing and guidelines, as well as exercise calendars and classes so that you know exactly which exercises to do each day. So it takes the thinking completely out of it. You just log in, press play, and get your exercises in. I hope you found this episode helpful. Thanks so much for tuning in. I'll see you next time.